Our final presenter will be the Dr. Adipur.
Good afternoon, Council member. My name is Adipur, Director of the Douglas County Health Department, address 1111 South 41st Street. Thank you for being here, and I feel really honored to be in the company of such great infectious disease doctors that we have the capacity in this community, and we all should be grateful for this. But what I would like to kind of share with you today, why do we need a mask mandate? We have widespread community transmission. Our 7-day rolling average for Douglas County is 116 cases per day in this community, 116 cases. Now, when you talk about and you listen to the media, you may often hear that they like to say to do it per capita, per million. And when we do it, that the 7-day rolling average for Douglas County is 203 cases per million per day. Let's put this in perspective. What does this really mean? The Global Center of Health Security at Nebraska Medicine, they reviewed 16 countries in the world before they opened school. And what they found is that every country had a transmission rate below 50 cases per million per day. We are at 203. The BRAMS model is also a model that comes out of Nebraska Medicine, also suggests a threshold, and there the threshold is 10 new cases per million per day. We have a long way to go with our 203 cases. Last week, we had 812 new cases. The week before, 944. So that is really a reduction, and we like to see that, but we have a far longer way to go. Let's just put it in the perspective. I looked at the General Electric has a dashboard. There's lots of information out there. Everybody looks at it slightly different again. And for me, it's interesting to look at that. But the dashboard was a wake-up call to me. And I thought maybe that this community is really not aware of what we see in regards to this disease. They look at different metro areas, and what they are looking at, how many cases have we seen in this community since the beginning of the pandemic? In Douglas County, since the beginning of the pandemic, it is 11,449 cases. Then they are looking at it per capita and comparing it to other metro areas. I just want to share with you some of the cities that have had less cases per capita than Douglas County. Seattle, Portland, San Francisco, Los Angeles, Dallas, Houston, Atlanta, Durham, Baltimore, Philadelphia, Boston, Cleveland, Detroit, Cincinnati, Chicago, and Denver. All those metro areas had less per capita cases than we had in Douglas County. That should be a wake-up call for all of us. We also talk about the positivity rate. And I want to share with you, last week the positivity rate was 9.9%. The week before it was 11%. So we are seeing a decrease. But let me put that in perspective. What do we actually expect? We hear from the experts and from WHO and CDC, actually the case count, the positivity rate should be below 5%. We have not been below 5% since April 18. Many people can say, well, cases, it depends on what the testing is in your community and so on. That's why you may see more cases. But what nobody can argue against is hospitalization. As of yesterday, we have 118 total inpatients diagnosed with COVID in the Omaha hospitals area. That is reports from the hospitals. Put it in perspective, we had 68 patients in the hospital with COVID on July 9th, and we have seen a steady increase since then. So over the last 4 weeks, we have seen a 42% increase in hospitalization in our community. This community spread that what we are seeing now is really difficult to control. You remember April, May, we had really high counts, but they were related to big clusters in food processing plants. That is more easy to control because we know than it is around that cluster. What we are seeing today is we are seeing many small clusters, 2 to 3 people, construction companies, and so on. So it is much more difficult to actually control this. So I want to close really that we need to bring this under control. There are 3 W's that people often cite: wash your hands, watch your distance, wear a mask. And I would add a fourth: win. We can win against this virus. We know that wearing face coverings, and you heard before the studies from the hairdressers, many other studies that are around, studies in laboratory that show very particular how particulates cannot go the distance if you wear a mask. But we also have now new case studies that show that counties that have implemented face coverings, universal face coverings, are showing a much faster decline in their cases. That's where we need to be. And we do not need to go too far. We see it in Lincoln. We see it that since implementation, there seems to be a decline in Lincoln too. As a community, I just would urge us all, let's come together, protect each other, protect this community, protect our students, and protect our local economy. When we all mask up, we all are safe. Thank you so much.
Thank you, Dr. Poor. That concludes the presentation on behalf of the introducers of this